Good morning. This is the Northwestern Rapid Response Laboratory. We are locating in 1810 West Garfield Boulevard in Chicago, Illinois. Who are we? As the Northwestern Rapid Response Laboratory, we are a self-run laboratory that works in conjunction with the Northwestern Outpatient Emergency Department. We are committed to providing on-site, around-the-clock, timely, and high-quality stat clinical laboratory services with an undivided attention to any of the patients present at the Northwestern Outpatient Emergency Department. We make sure that our quality of service, as well as our timely response, is adequate and satisfies everyone's needs. The Northwestern Rapid Response Laboratory is accredited by CLIA and the Joint Commission from June 2019 to June 2021. So we are fully accredited to provide our services.
Scope of service. The Northwestern Rapid Response Laboratory operates as a full-service lab that provides a wide range of point-of-care, moderate, and some high-complexity clinical testing in areas of hematology, microbiology, chemistry, immunology, and serology. The laboratory is staffed at all time with ACP certified and experienced medical technologists and technicians able to adjust to variable workload demands in order to deliver efficient and reliable results 24 hours per day, 7 days a week, year round. Population served. The Northwestern Rapid Response Laboratory is part of the freestanding Northwestern Outpatient Emergency Department, which serves the populations of the southern neighborhoods of Chicago, Illinois. The laboratory staff will work in close connection with the ER doctors and nurses to provide immediate medical care to patients of all age groups with shorter test turnaround times and minimal patient wait times.
Here at the Northwestern Rapid Response Laboratory, our mission statement is to provide streamlined, effective, and patient-centered care 24 hours a day, 7 days a week. We focus on accessible, high-quality, and cost-effective healthcare for the community of Chicago. Our team is dedicated to enhance the existing model of healthcare, providing leadership and excellence in all areas.
At the Northwestern Rapid Response Laboratory, our vision is to become one of the best rapid response freestanding laboratories that is dedicated to enhancing patient care at a rapid time frame while also ensuring staff needs and knowledge is satisfied. Meaning that we make sure that while we do maintain a rapid response to patient care, we also make sure that both our employees, all of our staff, and anyone associated within our Northwestern Rapid Response Laboratory is fully qualified to make sure that all needs and necessities are met.
Regulatory and proficiency testing agencies. The Northwestern Rapid Response Laboratory meets and maintains accreditation with the Joint Commission, in which a majority of U.S. state governments recognize as a condition of licensure for the receipt of Medicaid and Medicare reimbursements. In addition, the NRRL follows operation and regulation guidelines from the CMS, which conducts inspections and enforces compliance, CLIA, which regulates lab testing and require clinical labs to be certified by their state in addition to CMS, and the FDA, which monitors and provides guidance for CLIA complexity organization.
At the Northwestern Rapid Response Laboratory, we provide a range of tests varying between waved and non-waved tests, meaning that wave tests are usually carried out on site with the patient and usually run a low risk of inaccuracy and can be conducted outside of the lab setting. Non-wave tests, usually called moderate or complex testing, are performed in the lab site and require certain regulation clearances. So we provide both simple to complex tests when it comes to working with our patients' needs. Some of the tests that we do offer at Northwestern Rapid Response Laboratory include some of the basics like the waved urinalysis, blood glucose reading, even HIV testing for any situations that may arise. Other complex tests that we also offer include non-wave tests like platelet counts, white blood cell count, creatine or gram stains that may be needed, certain assays, mononucleosis. So we provide a variety of tests that can satisfy the needs of those patients that come through that Northwestern emergency department.
In terms of instrumentation, the Northwestern Rapid Response Laboratory implemented the latest and FDA approved laboratory technology to ensure increased workflow efficiency and enhanced testing quality and reliability. The hematology department will perform its automated CBCs, differentials, reticulocyte, and body fluid counts on the Sysmex XN 3000 series analyzer, which uses a fluorescent flow cytometry technology for increased specificity of cell analysis. The compact configuration of the two analytical modules and an integrated SP10 slide maker and stainer allows reflexive slide preparation to optimize the workflow. The WAM middleware is integrated with the institution's LIS system, and the reflex rules have been customized based on our own criteria to improve productivity and reduce clinical errors. To better serve the needs of our patients and medical staff, the Northwestern Rapid Response Laboratory will be offering both in lab and point of care chemistry urinalysis tests using the Clinitech Novus and Clinitech Status Plus analyzers. The Clinitech Novus is the latest urine chemistry analyzer from Siemens, which combines a dry pad technology with an easy to use cassette test format to help ensure standardized urine results and maximum productivity. The Novus can handle a lot of samples at one time, and it has an onboard barcode reader that reduces potential for errors reading sample IDs. It also has a digital camera that measures the color of the dry pad to improve accuracy of urine test results. On the other hand, the Clinitech Status Plus is a simple and intuitive device used for point of care urine testing to obtain fast results in approximately 1 minute. Aside from point of care urinalysis testing, the Northwestern Rapid Response Laboratory will also offer glucose and troponin point of care tests using the Contour Next 1 glucose meter and the Philips MiniCare handheld troponin test. The glucose meter delivers highly accurate results comparable to in-lab values and offers instant feedback if blood glucose readings are above, below, or within target range. The Philips MiniCare i20 handheld troponin system delivers laboratory comparable results as well, and it does that within 10 minutes and from using only a single droplet of blood. The Northwestern Rapid Response Laboratory uses the Cerner Millennium PathNet GenLab LIS system due to the company's long history of service in the healthcare technology industry, 40 years to be precise, great customer service, and a relentless commitment to innovate the laboratory workflow through easy information sharing with minimal manual steps. Cerner can handle high data inputs without lag time, is highly customizable to allow the system to better serve the needs of the laboratory, and uses the large and trusted Oracle database. Even though the price of implementation may be slightly higher than other LIS competitor systems, it was determined as being essential to use a laboratory information system that has proven itself reliable in terms of result transmission and functionality, In order to ensure that the laboratory is able to efficiently meet the needs of the emergency department it serves, with improved turnaround times and minimal downtime. In order to ensure that the testing staff of the Northwestern Rapid Response Laboratory meet the CLIA personnel requirements and be able to demonstrate it during the biannual inspections by the Joint Commission, electronic binders have been set up for each employee to record and maintain documentation of information such as the highest level of formal education, employee's resume, ASCP certification, job description, orientation records, laboratory specific training records, annual competency evaluations, and continuing education credits. The laboratory organizational structure and the testing personnel requirements are highly influenced by the complexity of the tests performed in the lab. Since NERL performs waived, moderate, and some high complexity testing, the laboratory director, Rosalind Franklin, who is certified by the American Board of Clinical Chemistry, will also fulfill the roles of clinical and technical consultant as per CLIA requirements. Additionally, each laboratory department and its testing personnel is overseen by its own manager and supervisors. Medical technicians will aid with specimen receiving and pre-analytical processing under the guidance of a specimen processing manager and supervisors. Point of care testing will also be managed by the Northwestern Rapid Response Laboratory.
Within the personnel binder, we do require certain training policies, for example, annual training and evaluations when it comes to our clinical employees. Every calendar year, all laboratory employees must complete the following. They must review the policy and procedures manuals within the area of their responsibilities. They should attend in person fire safety training. They must complete the assigned web based training modules for the current calendar year. They should also complete 12 credits of web based or in person continuing education for professional certification maintenance, basically to make sure that their certification is up to date. They should also successfully complete competency assessments for all laboratory procedures or procedures for which initial training has been completed in the area of responsibility. Participate in satisfactory in annual proficiency testing, for example, for the Joint Commission. They need to be able to satisfactorily complete annual proficiency testing to make sure that they are well aware of policies and regulations that may be changing within our field. And they should also review and acknowledge all procedures for newly implemented methods. Within science, we always have new technologies and new trainings that may come up, so it's important for our staff to always be up to date. One of the factors of our annual training or evaluation that is part of our training policies is continuing education. Here at Northwestern Rapid Response Laboratory, all staff is required to participate in some form of continuing education that is related to the specific job classification for each individual. All staff assigned to our lab is required to have a minimum of 24 hours of continuing education credit within a 2-year standard period, meaning that within a 2-year period, there should be at least 24 hours of that continuing education. Within the training policies that were just discussed in the previous slide, Northwestern Rapid Response Laboratory requires continuing education. So certain guidelines have to be met for continuing education to be approved. If you are a regular employee, not a manager, but a regular employee, you need to obtain the minimum continuing education within a designated time frame. So that is 24 credits within a 2-year time frame. They need to provide documentation of attendance to a manager in order to make sure that they get that credit approved, and they need to be aware of required training and follow through on obtaining this required training, meaning employees need to be responsible of their own training and make sure that they satisfy the training requirements within the 2-year time frame. Management has to review the continuing education documentation at least annually to verify personnel have maintained the minimum level required. They need to file a summary of continuing education in the employee's personnel file, and they need to use the approved criteria on the performance management tool for evaluating personnel on meeting continuing education requirements. As a manager, you do not need to do continuing education. You need to be responsible for your employees and making sure that your employees are satisfying the requirements needed. So there's certain criteria that needs to be met in order to receive that continuing education credit. Certain things that employees can do to get that credit is they can attend a lecture, seminar, conferences, and workshops. Um, and these workshops and conferences, seminars will be credited according to the length and hours of the program. For example, if you go to a 1 hour seminar, then you get a 1 hour credit. You get half a credit or a full credit based on how much time you spent there. Developing and presenting a program, workshop, conference, in service or lecture will be credited for 3 hours for every 1 hour of continuing education credit presented, meaning that for every 3 hours of a seminar, for every hour of a seminar that you create, that an employee creates and brings on and teaches something to our other employees, they will receive 3 hours worth of credit. Publishing in a recognized journal, the number of if you publish within a recognized journal, the number of continuing education credit will be determined based on the division, meaning whatever section within our lab that you are working in will dictate how much credit you will get based on the article or the publication that you submitted. Presenting orally or by poster before a professional audience at a national, regional, or local meeting will be given 2 hours of continuing education credit. So if you do something big in that format of presenting your work to not just management here within our Northwestern Rapid Response Laboratory, but within our organization as a whole lab environment, then you will receive continuing education credit. Continuing education credit for reviewing tapes, slides, videos, and or other types of educational material will be determined based on the division. Basically, if you do your own research, make sure that you maintain and review and continue researching information on your own. As long as you get it approved by your management within your department will dictate how much credit you will get based on that research you conducted.
Competency assessment. At the Northwestern Rapid Response Laboratory, all technical, supervisory, and testing personnel must successfully complete competency assessments semi-annually in the first year, annually thereafter, and before implementation of a new method or instrument. Our lab's competency assessment serves to demonstrate the laboratory personnel's capability to perform their lab duties correctly, safely, and in accordance to the established procedure protocols and federal regulations. The assessment is monitored by the laboratory's current technical advisor, and each competency assessment uses a combination of methods, as listed in our sign-off table, to assess skills, knowledge, and experience of lab personnel. Each competency event must be properly documented with procedure, name, date, as well as names of observer and observee, and is maintained in the employee's file along with supporting evidence.
The safety plan. A written safety document is put into effect to ensure a safe and healthful laboratory environment for all personnel who work in the neural laboratory, and also to make sure that local, state, and federal regulations are being followed. The main message at the heart of the safety plan is that the safety of our employees and patients comes first. The safety plan serves to inform all laboratory employees about possible chemical, biological, physical, or radioactive hazards associated with their job responsibilities. It specifies the appropriate protective measures that can be taken to minimize the risks of exposure. The information is made readily available to all. Therefore, employees are expected to know and adhere to safety regulations at all times. as well as be able to detect and report any potential hazards to the supervisory staff, the appointed safety officer, or the chemical hygiene officer. The laboratory's adherence to safe practices is overseen by the appointed safety officer and chemical hygiene officer, along with individual departmental managers. All new laboratory personnel must receive an in person site specific safety orientation and training before beginning independent work.
Let's take a closer look at one of Northwestern Rapid Response Laboratory's SOPs. Each standard operating procedure, as seen with this urinalysis example, offers a step-by-step set of instructions compiled to help workers carry out complex routine operations. The SOPs here aim to achieve efficiency, quality output, and uniformity of performance, while also reducing miscommunication and failure to comply with industry regulations. MSDS. Our material safety data sheets follow the OSHA standard to ensure that all materials, if needed, are labeled properly here at the NRRL. Each MSDS is simple and easy to read, making important information as accessible to our faculty and staff as possible. These are documents that provide workers with procedures for safely handling or working with a particular substance. We make sure to include technical information like boiling points, toxicity, reactivity, and even handling precautions. When new regulatory information, such as exposure or health effects, become available, the MSDS is always updated by our safety officer.
Thank you all for listening.